So my first question to you is, at what point is it safe to go out and see the elderly population since they are getting vaccinated?
I think we don't know is the truthful answer. And what I would want to look at is when we have immunized the vulnerable groups, the elderly, people with clinically vulnerable conditions, etc. And then we also monitor and watch the case numbers. And we also monitor and watch how well the vaccines are performing. Because on the one hand, we know that we've done the experiments to license the vaccines, but it's also important to see how well they perform in real life. So there are a lot of unknowns, and often people make up answers, or people are afraid to say, we don't know. So my answer is, we don't know. We don't really know. What we do know is that it's important to be cautious and careful and measured in our interactions with people. Of course, I accept and I admit that once the vulnerable group has been immunized, as well as the other groups of people are also immunized, the risk overall to both sets of people diminish considerably. And what I mean by risk is the risk of severe disease and death. That diminishes considerably. Under many circumstances, we feel it is still possible to get infected, be infectious, but be protected from severe illness.
So just to reiterate what you're saying, that even though the elderly population are getting vaccinated, so your grandmas out there are getting vaccinated, the concern is you still don't want to be going there without your mask on. You still want to socially distance and making sure that they're kept safe, even after the second vaccine, Dr. Bharat?
That's right. So my answer is, at this point in time, because there are a lot of unknowns, even after the second vaccine, we continue with all infection control measures until we have a better understanding. And then we can gradually, and I'm sure it will happen, we can gradually reduce our extreme infection control measures.
When do you see that happening? Because obviously it is Valentine's Day, and this is time everyone's thinking about their loved ones, and we want to be close to our families. So when do you see that realistically happening?
So I think it will start to happen when at least 50% plus of the population has been immunized. And secondly, when we are better able to control outbreaks. And thirdly, when we are also immunizing a lot of people abroad in other poorer nations. Because when we immunize people abroad, also in poorer nations, we suppress the infections. Because what happens in India, Africa, Asia will also come to Europe and the United States. So that lovely glow of we on planetary levels are in control of the outbreak is many months away, if not many years away. Unfortunately, it is very difficult to get politicians to engage on no one is well until everyone is well. So we need that double approach of we need to make the whole planet well, immunize nationally and internationally simultaneously.
Basically spreading the love around the globe, right?
Indeed, indeed.
So we really need to understand transmission. And I know it keeps changing. CDC changes its guidelines. Let's really dive into transmission, because I feel once we understand transmission really well, then we can keep ourselves really safe. So we know we can catch it through the eyes, the nose, and the mouth. So these are the things that we have to protect. Now let's talk a little bit about when people are in rooms, for example, let's say a family member comes in, how is that transmission happening? People are speaking and then the virus particles are going in the air, or if they're sneezing, then it projects out even further. That's why that 6 feet rule is there. Can you just elaborate a little bit more and explain how to stay safe in an enclosed environment for us, Doctor?
So one thing that we have thus far not emphasized enough is an element of aerosol spread as well. And what I mean by aerosol spread is these fine droplets travel in the air. They're invisible. You can't see them, you can't detect them, but they're invisible and they travel in the air and they remain suspended in the air, and they travel a much greater distance than your 2 meters. So, as you know, as many people know, we have worked very hard on this thing of keep apart 2 meters. However, with respect to aerosol spread, it isn't 2 meters. It is the environment, the whole room, that cavity may be full of virus particles suspended and in circulation. So if you walk into such a room, even if you keep your 2 meters and there is a lot of the particles in circulation, you could get infected. And it is for that reason that if you are in a room where you are meeting other strangers, you should also be wearing a mask, and you should be wearing that mask properly. And you should also make sure that the room is properly ventilated. Ventilation reduces the number of virus particles in circulation, and by reducing the numbers, hopefully it will be low enough for you not to get infected.
Thank you for explaining that. I think the biggest thing about the virus is we don't see it. From my background, my medical background, I'm used to kind of studying about viruses such as you. You understand that, how they work. And for the general public, it is difficult because we're not used to dealing with viruses. So the analogy I tell my patients, my friends, is kind of like if you're in a room and you smell something, you can't see that smell, and it could be somebody cooking from quite far away, but you do smell it. So it's there. It's like, and even items on a table, if there's dust, for example, you kind of only see it once it's actually up in the air, but you don't see it. So that's the challenge with it being so invisible. So when we're out there in a room, we have to remember that there are particles that are just suspended. And how long can a room be infected, Dr. Parra?
It depends on a number of parameters in the room. So it depends on the temperature, the humidity, and the number of people who have been in and out. So, up to 3 hours of suspension of the virus particles. And then unfortunately, and this is where it gets worse, is of course, if there is no drying out, then they can, fall down and then be resuspended. So there is a lot that we know, and there is a lot that we don't know. The bottom line is, don't dwell on how long is a room safe or not. Dwell on, I'm entering a room where people have been. I am therefore going to take precautions. I'm going to wear a mask, and I'm going to wear it properly. I'm not going to touch a lot of surfaces unnecessarily. I am going to keep my hands away from my nose and mouth. I am going to make sure I wash my hands and dry them frequently. When I cannot wash my hands and dry them frequently, only then and only then I will use a hand rub, an alcohol gel, to keep my hands clean. But overall, the best way to keep your hands clean is warm, soapy water. Wash them with warm water and dry them. That's the way. So you exercise all those measures, because unfortunately, this virus can be found in rooms, and it's aerosol spread. Therefore, the 2 meter thing helps, but it's not an absolute help. In other words, I repeat again, that if you are standing 4 meters away and the droplets are aerosolized, you can still get infected. It's all over, it's all around the room. So this 2 meter thing, whilst it helps, it's not an absolute help.
Well, thank you again for clarifying that. I think that's really important to stop the spread, is that people shouldn't be gathering together in rooms. And let's say if you happen to be like grocery shopping and, you know, where you could be exposed, but you have got your mask on, you are protected. What are the precautions you can take? Should you be like, when you get home, making sure that you change your clothes, have a shower, wash your face and hands, obviously?
Yeah, Sheila, you ask good questions. So, so Sheila, I also want people to live a normal life, and I think that's very important. So, I have advised for a very long time is you have a ceremony of going out, which is you go out prepared with your mask and all your other items, and you have a mental mindset of I'm now going into the shop, therefore I'm going to be consciously alert and aware about the dangers those places pose. And then reversing it, you are also consciously aware of all the dangers that you may be bringing into your home. So what you do is arrive at home, have a box at the entrance to your door on the inside of your house, and in there dump all your accoutrements that you brought from outside, which is your mobile phone, your car keys, your wallet, your handbag, other things, etc. Put that in the box there. And then without touching anything, without doing anything, take your shoes off. That's always good. Then walk to the sink. You wash your hands. You wash your hands thoroughly and you dry it also thoroughly. Washed and dry hands are very important. Then you come back to all those things that you dumped in the box, and you can either give it a wipe with a, a moist wipe, or just leave them there for when you're going to go out again. But you need to have some sort of an order in how you go out of the house and how you come back into the house.
And even mask removal, can you touch upon that? I know a lot of people are touching their masks and they're not like taking it off. We need to remember that that mask has been, the outside of that mask has been exposed. So once you're at home, can you demonstrate how to safely remove a mask, doctor?
So it's important to have a minimal touch technique with respect to your mask. And furthermore, don't just remove it and put it in your pocket. You really ought to have a little wallet or a plastic bag or something similar in which you put your mask. Or ideally, and really it is important, you dispose of it safely and have a fresh one ready for next time. So depending on your mask use, the type of mask you're using, don't overuse it, don't use it excessively, because they do degrade, they do deteriorate. So please keep on having a fresh mask. It's better that way. I was saying, let me demonstrate this because it's really important. So these are the sort of typical masks that people come across, and you need to put it on. I'm doing it again. You start at the top, mold it to the top of your nose. Notice I have hardly touched it. And then holding it there, mold it to your cheekbones. And that's wearing the mask properly. You see how high up the nose it is, and it is snug everywhere. And then when you want to remove it also, ideally you're going to remove it. You see, I didn't handle it at all. So I remove it and dispose of it into the dustbin. Or if you're going to reuse it because you've only used it for the last half hour or so, then put it in a plastic bag or something like that, because you don't want it in your pocket getting dirty. It's going to go next to your nose and mouth. So ideally, fresh mask, if it is just had very minimal use, in a plastic bag to be reused, but please don't reuse these things excessively. A good, clean mask is equally important, especially as we have a more infectious variants of the virus in circulation now. In fact, the Centers for Disease Control, United States America, is now recommending double masking, and they're not off balance. That's not a bad idea. This is really of big concern. We have a more infectious variant of the virus in circulation, and you either wear a high quality mask, FFP3 we call it, and there are N95s, etc., or double mask it. The days of wearing, and I see this all the time, the days of wearing a flimsy cloth like this around your nose and mouth, please say goodbye to it. It's rubbish. Don't do it. You will get infected. It's not worth it.
And again, with the masks, you want to be a tight woven mask, a couple of multiple layers. So, I mean, think about it. What's happening if that virus is coming in? You want that first layer to protect it. You don't want it to be able to go straight through. So if you have a tightly woven thing, it's now kind of having difficulty passing through. And the more layers, the better it is. So if we're double masking, then the safer it is. You did mention, Dr. Bharat, about like you can reuse these masks. Now, ideally, the cloth masks should be washed immediately. But for the ones that say you've used only for 30 minutes or so, how long can you put it aside before you can use it again?
Oh, you can reuse it if they are in a reusable condition. So I always say that with respect to these disposable mask type things, have a maximum of 3 hours use, right? So you sort of say to yourself, once I have used it for more than 3 hours, the end, dispose of it properly. And the reason why I am going to these extra lengths now is because I do feel that it is important to wear a mask properly, but it is also important to have a mask that has its integrity intact, right? So, we know, both of us know that per patient, we would change our masks in surgery in clinical setting. And usually our surgery is per patient. But if it was a long journey, you went out, etc., I personally think once you've exceeded 3 hours, you should change your mask. Because you and I are in a clinical setting and we're very careful in a sterile environment, but nevertheless we change our masks. So here, when you're out and about in the streets, etc., it's not a clean environment. So you should change your masks more often.
Which also now brings me to the next thing, gloves. I'm seeing a lot of people wearing their gloves and they feel like it's protection. So then they're touching surfaces, even at the grocery store. Now, remember, at the grocery store, many people are touching your avocados, the fruit, the vegetables, the containers, the door handles. Then they're touching the door handles, the food, and then they're touching their faces, they're touching their phones. Gloves aren't there for protection. It's not a case of you touch something, you have the virus, and then it goes through your skin. The glove is there almost as a reminder. Can you talk a little bit about that, Dr. Bharat? A reminder to not be touching your face.
Yeah, Sheila, that's again a lovely and important question. Don't wear gloves. It's silly because you see, when you are operating in your clinical setting, we wear gloves because we don't want to introduce infection via our dirty hands into a patient's surgical area. Even though we meticulously surgically scrub our hands, we still put on a pair of gloves because it is an added layer of protection in a clinical setting. Now, when people are putting on these gloves, it's a false sense of I'm protected. You're not protected from anything because the gloves are dirty, they're contaminated, and that contamination will go from your gloves to your nose and mouth. And the second thing is what we call risk compensation. So when people drive cars and they've got the seat belt on, they drive with a little bit less caution compared to if you've got a loose box around, you will drive with a lot more care. So similarly, there's this risk compensation, which is I'm wearing gloves, therefore I'm okay. No, you're not okay, because those gloves can also introduce infection to your nose and mouth. And furthermore, you may even be more careless because you're wearing gloves. So ideally, don't wear gloves, wash your hands frequently. Timetable washing your hands.
Dr. Bharat, on the final question, groceries. Groceries are coming in, and you go to a grocery store. Are we still having to do that ceremonial disinfection of our packets, or is it? Well, I mean, what I do is I take all my groceries, the things that are perishable, I kind of wipe them down and put them in the fridge, and the things that aren't perishable, I just kind of leave them for a day or so and then put them away. Is that the right thing that we should still be doing?
Number one, whatever that keeps you happy. But having said that, I need to say it's a low risk event. And it's a low risk event. And remember, the weakest link is there isn't something in the groceries that's going to jump and find your nose and mouth and infect you. Highly, highly unlikely. But what it is if you have the mindset that whatever I touch is infectious and contaminated, then what you say to yourself is the weakest link are my hands. So I'm going to keep my hands away from my nose and mouth. And number two, I'm going to wash them frequently and dry them. So washed, clean, dry hands, having handled your grocery, is much better than you sort of assiduously washing and drying and pampering your groceries, etc. Because there's millions of items outside that is beyond your control in terms of how clean it is, your door handles, your handrails, etc., that you touch on buses, tubes, trains, shops, etc. They may be clean, they may not be clean, but what you do is you keep your hand that has been touching all these things clean. So really what we should be saying is wash your hands, dry them, keep them clean. That is where you worry about, rather than you worry about, do I need to wipe clean the groceries, etc.
Thank you so much again, Dr. Barr. It's always a pleasure to have you on our show, and you always give us such great advice. And I know we'll be seeing you soon, giving us updates on the vaccine, on COVID-19, and thank you again. And I know I'll be probably seeing you in the next couple of days on the news somewhere. So thank you again. And